Hey guys, I just wanted to do an update on what's been going on. We've been kind of missing for 5 weeks now, and I just wanted to kind of update what's been going on and why life has been so crazy. Since Sydney's been born, she has been having issues latching and nursing properly, and it's caused her to swallow a lot of air and have colic and reflux and gas issues. She cries every night from like 5 to 11 p.m., sometimes longer, sometimes shorter, but that's usually what happens. So she's in significant pain from that. What we found out was that she has a lip tie, and that's the little, it's called frenulum under. You can take them, Keegan. Just take them and go, please. Underneath the lip that attached your lips to your gums, and there's one under your tongue. They're too short and tight, so her tongue, I'm trying to do this really fast, sorry if you can hear the kids yelling, but her tongue can't move properly while she's nursing, and her lip can't flare out and latch properly, so it's just causing lots of issues for us. She's not draining the milk properly in my breast, so I'm getting lots of plugged ducts and mastitis a couple times, and it's really frustrating. So she is gaining weight well, which is awesome, but that's probably due to my oversupply of milk. So it's basically like she's latching on incorrectly and the milk is just draining into her mouth and she's getting enough milk. But the worry, one of the biggest worries, other than all the other issues that we're having right now, is around 3 or 4 months old. Babies, your breasts, they start regulating the milk to supply demand, and it's not so hormonal and off of engorgement like it is now in the early weeks. And so at that point, the way that she's nursing probably will not stimulate my breast correctly to produce enough milk. And so we're kind of worried about that. It won't be that she's just living off of it, draining, and it could drop so drastically and so quickly that we would have to supplement with donor milk, which is kind of difficult to get. I mean, it's a hassle, and I don't want to deal with all that. So yeah. So I've done a lot of research, and we made the decision that we are going to have revision surgery done, and that's actually scheduled for tomorrow. That's why I wanted to get an update up. So what they're going to do is they're going to use a laser. It's like the size of a pen, this laser, and they, numb her, and then they're not going to put her under anything because that's not safe at her age. And then they're going to laser these ties, which it's a lot safer and has less complications than just clipping with scissors. And it kind of seals off as it goes, so there's not, sorry, I'm going to rock, there's not as much bleeding and that kind of stuff. I think the infection risk is lower as well. So I actually have to drive out of state to Iowa. We live in Illinois, tomorrow with her to have that done. It's kind of scary and I'm really nervous, but I know that in the long run it's best for our nursing relationship and best for her because there's complications like with speech and eating that she can struggle with later on. Well, she most likely will because her tongue isn't working properly. And her lip is not, and she can also develop some serious tooth decay from the lip tie. So we're not so worried about the gap in the teeth because I have that. So that's kind of like a genetic family trait that is in my family, and so I'm not doing that okay, what am I trying to say? The main purpose of this procedure is not cosmetic, and for that reason. So if that was the only thing that was going to come of it, I would not have it done. But, and also, if we weren't having all of these symptoms, I would probably consider not doing the revision at all. But because we're having symptoms, or delay the procedure till later if stuff came up. But since we're having these issues now, and I'm concerned about, supply, I want to nurse her long term. So breastfeeding is really important to me, and I know it's the most normal and best thing for her. So I want to protect our relationship by doing this. So we've made that decision. I wish Chris, it's my husband, I wish he could be there with me, but he has to work. And he can't get out of work because he took all those days off around her birth. So I'm going alone. I'm dropping the kids off at a friend's house to be watched all day. They say the procedure only takes like 5 or 6 minutes, so that should be good. The biggest concern, I'm not really concerned about how the procedure's going to go. That's pretty simple. It's the recovery that I'm worried about keeping her pain under control and nursing afterwards and dealing with that. It's actually going to be a little harder because Cecily, the night before last, broke her foot. So she's in a little boot right now. She has a green stem fracture, it's called, or a buckle fracture on the top of her foot. So we decided on a removable boot instead of a cast because it was just the better option right now, and she should only be in it for like 2 or so weeks, so that's good. But I've been carrying her around also, and I've been like tandem wearing both of them, and I've had to carry her to the bathroom every time she has to go. She's scooting around a little bit, but she needs extra help right now, so that kind of adds to things being crazy. Just life has been insane in general. And just because, with a colicky baby with reflux and having to specifically nurse, leaning back to try to get a good latch, and just adjusting to having 3 kids has just been kind of hard. So with 2, it wasn't this hard. I think it's just because we have all these special, needs that need to go into feeding her.
The water bottle.
Okay, good job. Go sit down and drink it. So we're really, really hopeful that, having this procedure done may help how things have been going lately. And, I've heard people say that it significantly reduced the colic and the reflux as well, which we're hoping for. Yeah, so I'm not sure if I'm kind of all over the place. I didn't write out a list of what I was trying to say, but that's where we've been at. Other than that, breastfeeding, she's gaining weight well. So that's good. She's sleeping in here right now. I don't know if you can see her. Yeah. Oh, there's baby. Try to finish this before she wakes up. But she is gaining weight well, and Cecily is also nursing as well. Occasionally, she's been doing a little more since she hurt herself to kind of manage pain. But yeah, we're hoping that this will really help our breastfeeding relationship. I'll put some information about lip and tongue ties below if you're curious for more information about that, because it's really often missed by pediatricians and doctors, even lactation consultants at hospitals. Some of them don't know what to look for, and they misdiagnose them, and moms are in pain, and they don't know why. They're in constant pain, or their baby can't latch correctly. So I'll put that below if you want to learn more about it. Maybe I'll do a more informative video on it later. This is getting really long. I just wanted to get an update up on what's going on and ask for you guys to pray for Miss Sydney tomorrow as she has her little surgery, that everything goes well and that her pain isn't too bad afterwards, and that nursing gets better after that's successful. So I would really appreciate prayers and thoughts, positive thoughts from all of you, and I will try to update soon. Hopefully I can have some time. I just haven't had even a minute to think to be able to tell my birth story in a video or anything like that. So, but I will try. And yeah, thank you for all your congratulations and support when I announced her birth. And I will try to keep updating on what's going on with her. Might be able to get an update up after her procedure. So I'll see you guys soon. Bye.